Hi, I'm Dr. Dan Shapiro. I'm a plastic surgeon certified by the American Board of Plastic Surgery. I've been practicing in the Scottsdale Paradise Valley area since 1992, and I've been performing only aesthetic or cosmetic surgery, so that's all I do. A common question in patients that are having liposuction is, Dr. Shapiro, how is it performed and what is the safest form of liposuction? The answer to the question is it really depends upon both the patient and what they're looking for. Remember, there are different types of liposuction, and these are purely just techniques that may or may not involve different technologies such as vaser or other types of ultrasonic liposuction. The most important thing is to understand who is performing the liposuction. I think that's the number one factor that you have to decide, is who is going to perform your surgery. So no matter what technique is performed, it has to be performed safely with good judgment. So there is tumescent liposuction, there is ultrasonic liposuction, there's high definition liposuction, there is a safe liposuction, this SAFE, and it sounds as though safe liposuction would be the safest, but not necessarily. There are so many different techniques that are employed for different kind of situations. So the best idea in terms of trying to understand what the safest thing for you is the liposuction is performed with good judgment. You're not over liposuctioned. If a lot is taken out, it is safest to have you stay overnight so we can give you some intravenous fluids overnight. I think prophylaxis should be taken so you don't get a deep vein thrombosis with a risk of pulmonary embolus. So oftentimes we'll give you something to thin your blood and put on some compression boots. So, the safest kind of liposuction is that where somebody is screened to be a good candidate for the liposuction. They're screened to make sure that they're healthy enough to tolerate the liposuction. The liposuction is performed in a very, very meaningful way. When I say that, the technique should be excellent. I think good judgment should be employed to make sure that not too much fat is removed in order to get some good skin compression, and of course that you're followed up post-operatively in a fashion that can deal with any kind of situation such as a seroma or any incisions that we may not like. So really the safest kind of liposuction is performed by the safest surgeon. So the best way to figure out if you're a candidate for liposuction is to come in and get an idea about what you should be doing. Thank you very much.